It's not very common for the syphilis blood test to come back positive, in both cases, the preliminary and the secondary test. But when it does come back positive, the patient is understandably worried about what is next. Fortunately, syphilis will respond to a single injection of penicillin. If you don't want an injection, then it's also possible to take penicillin by mouth. It just requires a longer time period. People will need to take penicillin orally for up to a week to make sure the disease is under control. There are other antibiotics besides penicillin that will also cure syphilis. So if the person has an allergy to penicillin, then they need to discuss it with their doctor and try one of the other options. One of the most common alternative antibiotics is erythromycin, but there are a number that can be used. Once in a while, there's reasons to suspect that syphilis might be resistant to one of these. For example, if the person comes from an area where the syphilis hasn't responded to penicillin. In that case, your doctor may choose to use a different antibiotic. If there's signs that the person has had syphilis for more than a year, then many times the doctor will treat the person on a regular basis for as long as 3 to 4 weeks to make sure the syphilis is under control. It's even more complicated if there's signs that the syphilis may be affecting the brain. We see this sometimes in patients that have an HIV infection or people who are immunosuppressed due to other problems. Sometimes if they have signs that the syphilis is infecting the brain, then they'll need more intensive therapy, in most cases IV antibiotics. This is a very complicated process, and if there's any suspicion that this may be going on with you, then your doctor will usually refer you to an infectious disease specialist so they can make sure that you receive the proper treatment. In any case, once you complete the treatment for syphilis, you'll be able to proceed with your USCIS paperwork.